Hello, in this video we're going to select a patient from the eClinical schedule and then put in a history for the complaint of cough. I will do this step by step, then show some other parts of the patient history screen. So let's get started. This is the main screen that you get onto when you log on initially, and it shows the schedule, and if you check, we have one appointment here. Just reading through the top row, it shows visit type, called same day. Other visit types would be if it's a checkup or say an ADHD recheck. Appointment time shows the time the appointment was scheduled for. The patient's name, I'm using a test patient. The reason for the visit today is a cough. Sex, age, the visit status, they have arrived. This is the arrival time. And next, the duration, they've been waiting for 14 minutes. So to enter the patient chart and start documenting, I double click anywhere along this row. It's giving me a dialog box. Do I want to carry forward the current medications for the patient? I'll say no for now. So looking at the patient chart, it shows the patient name, date of birth, age, sex, phone number, insurance, so demographic information, address. So this patient has come in with a complaint of a cough. So let's document the history step by step. So chief complaint is cough, and that was the reason for the visit, so we can leave that. The next step is the HPI. So we click on HPI, we get this box. We need to choose the system we're documenting for. So since this patient has complained of a cough, we're going to look scrolling down for ENT, and over here we have ENT/respiratory. So we click on this, we get this box which is full of respiratory symptoms. We just pick some of the symptoms the patient has and document. So let's say cough, which is up here. So we tick, you'll notice it says complain of. So when we tick this box, it will come up as complaining of cough. We can put details. So we go along, duration, there's a duration box over here, and by clicking this toggle we could choose 1 day, 2 to 3 days, 1 week. So let's choose 1 week. Then we have options for cough. So we could choose a congested cough by clicking on it. It says all day long, we could click on that. It says croupy, we could click on that. And when we click, it populates on the side. So we did duration, we did a description of the cough. So if we're satisfied, let's say OK. And now you see it says complaining of cough. It has the duration and the notes. To go back to the chart and out of dialog box, we can go up here and X out. So now going to our history, HPI, we chose the ENT, and you see it reads 14-year-old female presents with complaint of cough for 1 week, congested cough all day long, croupy. So say we want to put in a runny nose, we go back to the HPI ENT, we scroll down looking for runny nose. On the side here we can scroll down. Here's runny nose, so we can put a check mark here, complaints of runny nose. We could put a duration. The duration dialog box is here. We click on here and we could put 1 week. We have options for the runny nose. So chronic, clear, copious cough, several days. We could put copious. We could put green nasal discharge. You notice that it says copious green nasal discharge. There really should be a comma in between to make it more grammatical. And so above you see this delimiter button, and here if I pick a comma, and now we pick clear, you see it has comma and clear, which is better. You can delete this by going over here where it says clear and pressing that, and so now it has gone. So let's input it again, clear, and let's choose copious. So you see it has a comma in between, so it's more grammatical. You could decide to change the color by picking it, selecting the two words, going to the C button over here, press the C button, which brings you up the color coding box. You could choose red, click on red. Satisfied, you click OK, and then you press again anywhere in the box, and now you see it has turned red. You're satisfied with this, you could click OK, and we are back to the runny nose, and then we X out of this to get back to the main chart. So we navigate by picking one of these highlighted colors. We input in the dialog box, and to get back there, we X out. The other ways of navigating the screen, but this is the first basic way to X out. X out. So on our HPI, usually you want to have some general symptoms. So usually you will always be picking constitutional general as well. And going to that, we have options. Appetite, we pick a few common options such as fever. We could say denies fever, check that. We could put under nutrition, you can move along, and you could put a note, drinking well, not eating well. Okay. You could pick sleep. Moving along here, you could put in normal. Okay. And then we get out of this box always by Xing out. So now we have our HPI, which shows ENT, 14-year-old female, presents with cough for 1 week, congested cough all day long, croupy, runny nose for 1 week, clear and copious. We have our constitutional, denies fever, denies sleep, nutrition, drinking well, not eating well. So that's our HPI. We will go next to review of systems. So again, we click on review of systems. And we have all the systems: general, nutrition, ENT, cardiology, gastroenterology. For this tutorial, we're going to use the ENT. So when you click on the ENT, you get ENT review of systems, which actually we have put in ENT review of systems as our HPI. So we'll choose 2 or 3 other systems for our review of systems. So let's review a general review of systems by clicking on general, and it gives us several options: energy level, Here you will notice when you press once, it says normal. Click again, it says decreased. Click again, it's blank. So you can just toggle like that, decreased. Let's go to fever, for instance. No fever, press again, yes. Press again, empty. You could do loss of appetite. No. Click again, yes, empty. So let's do it on yes. So decreased energy level in yes, that's our general. We need to choose 2 or 3 other symptoms, usually for our history. We could choose gastroenterology, and we just pick a few. Abdominal pain, we can toggle no, yes, blank, so let's do no. Diarrhea, no, we could toggle yes. Let's choose another system, dermatology. It has rash here, so we could pick no or yes. What will happen as you use the system, you will get to know and memorize some of these alternatives and have your favorites. So usually you're clicking 2 or 3 fast clicks for each system, since you already know what you want to put in and you're used to it. So let's X out of our review of systems and let's see what we have. So our review of systems shows a general, energy level decrease, loss of appetite, yes. Gastroenterology, abdominal pain, no. Diarrhea, yes. Dermatology, yes. So we have 3 systems reviewed here. Next comes our exam. So we go to examination. The examination gives you different templates. You can use the brief general exam, which is what you would use for most histories. And on the brief general exam, it gives you the general appearance, HENT, it gives you all the systems basically. By clicking on the side, you get some options. It first says alert, well hydrated, no distress. So that's a pretty easy one. You could click and then you would press OK, satisfied. And the HENT, we have options. Let's say he had a clear nasal discharge. We could read down, let's say he had a pink pharynx. Let's say he had boggy turbinates. When satisfied, you would click OK. You can go to chest. So you basically pick the systems that you want. And let's say clear to auscultation. You can go to heart. Again, when you click on, you have options. Regular, rate, and rhythm. You could pick that one. Abdomen. Click on that. You could pick. Let's choose soft, no organomegaly or masses. Okay. When satisfied, you can X out. And so now we have our examination. General appearance, HENT, chest, heart, abdomen. So as many systems as you want. Next, we need an assessment for the visit. So we go to assessment. In the assessment area, the way it's organized, you see you have assessments, you have favorites, and then you have ICD-10 code, which gives you all the possible codes, thousands of them. Normally when using the system, you would have saved your most commonly used codes in your favorites box. And so I'm clicking on favorites. And then we want to find in favorites the diagnosis. So let's use a diagnosis of cold. So I type in cold. You'll notice it says here contains. So the diagnosis contains the word cold. If you toggle this, you could change it to say starts with, but we're going to leave it on contains. And then go. And so now if you come up here under favorites, I have J00 upper respiratory infection cold. So that's the diagnosis I want. I just need to double click on that, and it goes down to the selected assessment box. So I can X out of here now, and you see assessments I have put in upper respiratory cold. Next step will be our treatment. So I click on the treatment box. If you notice, we have the diagnosis upper respiratory infection here. Down here under notes, I could write some general things such as push fluids, and I could pick a medication. To pick a medication, I would go to the add box, and then I would type the medication. It's a commonly used cold medication is, say, Bromfed. So I would type that. I would search for that. It gives me a list of medications, Bromfed DM. I would pick that. So under Bromfed, once I select the Bromfed, it gives me options, and I could pick one, say this option, press OK, and have my medication there. I will do a video about the details of picking medication later. So once we picked our medication, we have written push fluids. We X out of this. And so now we have an assessment, we have a treatment. The next step is to put in the visit code first. So click on visit code, and here we have add evaluation and management code, add ENM. So we click on that, and here we have options of visit code. These are sick visits, established patient, new patient, or preventive medicine checkups. This was a sick visit, so it was a sick visit. So we go to sick visit codes. It's an established patient, and so here it gives us the options for established patient. A commonly used code for a visit would be 213. So we click that. OK. So now we have a code 213. If you want to remove that code, you go up here, remove, highlight it, press remove. I show you want to remove, yes, and it's been removed. So let's put our code back in, add ENM. It's the established patient. We want a level 3 213 code. So we click on that. OK, so we have our code. Then we could do follow-up. We could pick 2 to 3 days, 1 week, 2 weeks, 3 weeks, a year. Let's pick 6 weeks, so it shows. And the reason for the visit, we could put recheck code. We're satisfied with that. We can close or X out. So now we have our history, coughing, the HPI with 2 systems. We have our review of systems. We have our examination. We have our examination. We have our assessment, our treatment. So this is just a basic introduction to show you how to put in your history. The next video will be about more detail on each of these sections to expand a bit on what we did today. Thank you for watching.